Good afternoon, everyone. I'm Michael Stein from the Harvard Law School Project on Disability, www.hpod.org, and I'm thrilled and delighted to be able to moderate this afternoon's session. Today, we will be presenting a timely webinar entitled Global Disability Rights, Perspectives from Around the World. The webinar is sponsored by the ABA Commission on Disability Rights, for whom I have great fondness, having been a member many years back, and the section of Civil Rights and Social Justice. This panel is one of many in a series of rapid response webinars. We're actively planning additional programming on a variety of issues, so please do visit us at americanbar.org/CRSJ for updates on these programs. That website will be included in the chat, so you can click onto it. During today's program, we encourage you to ask questions of our panelists through the question and answer box, not via the chat function. If you do not see the controls, please ensure that your screen is not idle. We will address questions at the end of the program. We will be sharing a recording of this program to everyone who has registered so that you can share it widely with your networks. With that, we're thrilled to bring you today's program entitled Global Disability Rights, Perspectives from Around the World. Our panelists today are Charlotte McClain-Nhlapo, Global Disability Advisor at the World Bank Group. I let you know in advance that Ms. McClain-Nhlapo will need to leave us shortly after her remarks in order to attend to an urgent situation in programming. She will be followed by Jules Smith, Communications and Government Relations Coordinator for the Council of Canadians with Disabilities, and finally by myself, Michael Stein. Each of our presenters will have as many as 15 minutes to share some thoughts on where we're going with disability rights, either around the world and or within their particular jurisdictions. In Jules' case, Canada, and mine, the United States, although we all have experience elsewhere. And Charlotte will lead us off by giving us her bird's eye view of what's going on in the world. So Charlotte, the forum is yours.
Thank you very much, Michael. And again, apologies that I will have to leave before the end of the webinar. But I'd like, to say thank you very much for this opportunity to be part of this webinar. And I would also, like Michael, like to congratulate the ABA for dedicating a session on global disability rights. And I'd like to use my time this afternoon to provide a brief and hopefully succinct overview of disability rights. And I will frame my remarks using the UN Convention on the Rights of Persons with Disabilities. But before I do that, allow me to share some numbers that I think are instructive in understanding the broader disability picture context globally. So we know that persons with disabilities make up at least 15% of the world's population. But we also know that this is an undercount. And we know this because there are major issues around the measurement of disability, the tools that are used to measure disability, and very importantly, the analysis of data, even where data on disability exists. We often see that data is skewed in favor of the medical model of disability, and where that definitions that are in place are often archaic and also follow very closely along the medical model. And yet we know that many people with invisible disabilities are often not counted. In the event and where they are counted, however, we see a dramatic increase in the number of persons with disabilities. So a good example of that would be in the US and in New Zealand, where you have fairly wide definitions of disability. And I mean, this is wide given the context of other definitions globally. And you have measurement systems in place. And in both of these countries, you will see that the numbers hover around within the low 20%. And if you juxtaposition this to numbers from post-conflict countries and disaster-prone countries where I work, the official numbers for disability can be as low as 2 to 3% of the overall population. So we know that there's something wrong. Something is happening just in terms of capturing the data and understanding the numbers of persons with disabilities in the given context. We also know that 80% of persons with disabilities live in developing countries, and therefore it makes disability a development imperative. And that's why the World Bank and many other development agencies are addressing the issue around disability inclusion. Another important factoid is around women with disabilities. And the research tells us that women with disabilities are 4 times more likely to experience gender-based violence than their non-disabled peers. We also know from research undertaken at the bank, at UNICEF, and in other agencies that 90% of children with disabilities in developing countries are out of school, many of whom will have never ever enrolled in school. So those numbers just begin to show you the disparities that persons with disabilities experience globally. And the same applies for persons with disabilities in employment, higher education, health outcomes. The numbers are always a lot lower than their non-disabled peers. And if I have some time, I'll come back to some numbers later on. But allow me to just pivot quickly to what I think about as the global authorizing environment for disability inclusion and disability rights, which is what we're talking about today. And it points me directly to the UN Convention on the Rights of Persons with Disabilities. The convention came into force on May the 8th in 2008. And it must be said that the convention itself was very or highly influenced by the Americans with Disabilities Act. And in many ways, both in terms of the negotiations, but also in terms of the substance of the CRPD, you can see that the ADA served as a model for the CRPD. And certainly the tenor of the CRPD reflects the principles that emerge from the ADA. So for instance, you will see in the CRPD, the Convention on the Rights of Persons with Disabilities, a strong emphasis on independent living. The introduction of reasonable accommodation as an essential pillar to ensuring persons with disabilities have access and can live in community and be part of society. Also the concept of universal design and ensuring that things are designed in a way that is accessible to all, including people with disabilities and different types of disabilities. So it's very clear that the ADA and the movement behind the ADA influenced the CRPD. The CRPD also distinguishes itself in terms of the process in which it was adopted. So what was very important about the CRPD, and Michael and I were both very fortunate to have been part of that process, were the negotiations. And what was interesting about the negotiations was that for the first time ever in the history of the UN, the ad hoc committee that was put in place to establish a drafting committee to advance the development of the treaty allowed for non-member states to be part of the drafting committee. So for the first time ever, we had national human rights institutions as part of that drafting committee. We had representation of organizations of persons with disabilities as part of that drafting committee. Now you might think, well, you know, drafting is drafting, but the importance of this was that it allowed for the lived experience of persons with disabilities to be directly reflected and considered in the actual drafting of the convention. So the process of drafting the CRPD was very important. There were some other really important issues in terms of other firsts in terms of substantive articles of the convention. So for example, one is Article 32 of the CRPD, and that's the convention, that's the article on international cooperation. And why this was important was because, again, another first, but what it does is it notes the importance of international cooperation in realizing the rights contained in the CRPD. And this was a very engaged discussion at the UN, where a lot of the member states said, look, it's not sufficient for us just to have a convention with rights. What we need to have are mechanisms to ensure that these rights are translated and implemented. And so having an article on international cooperation was very important. Another important article that I highlight from the CRPD is Article 33. And Article 33 was important because it sets out the national and implementation and monitoring systems at country level. And why was this important? It was important because what it did was it recognized that a lot of that rights happen at country level, right? And it was a serious intention to begin to localize the convention and make sure that countries feel ownership, and that organizations of persons with disabilities can be part of reporting out on the convention. I could go on article by article, but I am not going to do that. But just to say that the convention itself really is very nuanced in terms of bringing forward the specific lived experience of persons with disabilities. I wanted to quickly just talk a bit about the authorizing environment beyond the CRPD. So we've got the CRPD, which is this convention that has been ratified now by 182 countries. I'm sure Michael will talk about where we are in terms of US ratification. But it's been very important to see that we're close to universal ratification of the CRPD. Following the CRPD, we had the Sustainable Development Goals, which are a set of 17 goals set out by member states of the UN that work really well with the CRPD. In a way, they serve almost as an action plan to the CRPD because they begin to spell out specific modalities of how countries are going to action some of the rights that are in the convention. There are a host of other global mandates like the Sendai framework that provide a framing for disability inclusion. But let me just mention quickly what is happening within the bank and the authorizing environment that we have set out as an institution. So the World Bank has an environmental social framework, and within the framework, human rights are articulated in the preamble. In addition to that, the environmental social framework has a set of 10 standards. One of the standards is a standard on non-discrimination that makes explicit reference to disability. This is then supported through a number of other entry points into the environmental social framework, and it's bolstered by a good practice note that draws heavily from the CRPD. In addition to the ESF, we have a disability inclusion and accountability framework, which sets out a roadmap for the World Bank in terms of addressing disability inclusion. And it too draws heavily off of the principles enshrined in the CRPD. Now, it's important for me to say this because I think it shows you how international law can permeate into institutions such as the World Bank and begin to provide direction for disability inclusion. I wanted to share with you before I close a couple of recent endeavors that the bank has been engaged in that are specific to the CRPD. So a very recent project was a Romania project. So Romania has ratified the CRPD, and last year there was a request from the National Authority for the Rights of Persons with Disabilities, Children and Adoptions for the bank to provide some diagnostics on the situation of persons with disabilities in Romania, And the idea was that this would then inform and say and begin to develop the basis of a new strategy in Romania for disability that would go between the years of 2021 through 2027. And part of the task was to look at consolidating mechanisms to implement the CRPD. And so here we have a situation where countries have ratified, but now are thinking earnestly in how they can begin to implement the CRPD. Very recently, we had a request from Uzbekistan. Uzbekistan is in the process of ratifying the CRPD if they haven't done so already, because this is really hot off the press. So this might have happened in the last 72 hours. But there was a request for advice on what the future costs of implementation around the CRPD would be. So, I mean, this is really exciting to see that countries are coming to the bank and saying, look, we would like guidance, we'd like advice on how we can advance the CRPD and implementation of the CRPD in their countries. We have supported a disability commission in one state in Nigeria that's also looking at disability rights. And then more recently in Rwanda, we were part of a process to support the government in the ratification of the Marrakesh Treaty. And this is all to say that, the value of having an international treaty, in this case, the Convention on the Rights of Persons with Disabilities, really has begun to show beyond just national boundaries, the importance of having such a treaty in place. I wanted to just close off by talking about, oh, I see Uzbekistan has ratified. I'm so happy to hear that. That's fantastic. I just wanted to mention a word or two on COVID-19, because it's obviously something that has been with us over the last 18 months. And what we've learned from the pandemic is that it has disproportionately impacted Black, Brown, and persons with disabilities, right? And we know that these populations have been disproportionately disadvantaged as a result of COVID-19. And it speaks to the issues around access to care, access to health. It speaks to the issue around access to accessible information. And so one of the things that we did at the bank, in addition to our programming, supporting countries to think through what vaccine rollout projects could look like, and ensuring that persons with disabilities are part of that, we also developed an internal document that really sets out what are some of the barriers that persons with disabilities are experiencing during the pandemic. And then we also undertook a very comprehensive study of the impact of COVID-19 on children with disabilities during school closures. So at the height of the pandemic globally, there were at least 180 economies that had shut down their schools. And this had obviously an impact on children with disabilities that were often receiving services at school, receiving lunch at school, nutrition from school, healthcare from schools. And so what we wanted to do was to begin to document some of this information. And so I'll be happy to post that on the chat as soon as I wrap up. But just to say that it's been really important for us to continue to use a rights lens to disability inclusion, and to say that, when I started this work 20 years ago, Michael, we could count, how many constitutions mentioned disability. We knew pretty much which countries had legislation on disability, but now those numbers have grown. And this in part is because of the CRPD, but also because there's been a more robust organizations of persons with disabilities that are driving this agenda domestically. And we're beginning to see more lawyers who are taking up this issue and advancing disability rights. So thank you, and I'll hand back over to you, Michael.
Thank you ever so much, Charlotte, and thank you for making time in what is certainly an extraordinarily hectic and urgent day for you. Since you went to the substance, I'll just add on a little bit to your bio, if that's all right. And also note that your background includes having been a South African Human Rights Commissioner, and it was in that capacity that you represented the world's national human rights institutions at the CRPD negotiations. And you've also been the USAID disability point person, having been nominated and appointed by President Barack Obama. So your experience is global, and it's been a wonderful privilege being your friend and being your collaborator and having worked with you in many, many venues. Jewel, you're next.
Thank you, Michael. And thank you, Charlotte, for that broad perspective and overview. So a little bit about me and where I'm located. I'm currently situated on the unceded traditional and ancestral lands of the Coquitlam First Nation, which is now called Coquitlam, British Columbia, Canada. So I'm on the West Coast, and I'm really happy to be here today. I'm a PhD candidate, and my focus in my dissertation is on disabled mothers in Canada. And so I've conducted a human rights monitoring project in that capacity. And I'm also as was noted, I'm the communication and government relations coordinator with the Council of Canadians with Disabilities. And if you're not familiar with CCD or the Council, we are a consumer-led human rights disability advocacy organization with decades of experience. All of our members of Council are people with disabilities, and most of the people that work for CCD are also people with disabilities. So I'm just going to speak a little bit about the CRPD in Canada, and then specifically what Canada is doing around accessibility legislation at the moment, and then specifically some of the ongoing work that's happening in my time. So Canada ratified the CRPD in 2010 with 3 reservations, and we had our first review of the CRPD in 2017, wherein Canada took it to over about a year period of time, lift 2 of those reservations, leaving 1 reservation that still exists, which is on Article 12, which is the legal capacity article. And I think it's really, it's been very frustrating for the disability community to continue to have that reservation placed on, our international conversations, because if you're not aware, Canada continues to assume that certain people don't have legal capacity, including people who live with developmental or disabilities, and as well as people who live with mental health or psychosocial disabilities. And a number of our laws continue to greatly impact these communities. And CCD is doing some work to try to address, for example, the British Columbia Mental Health Act and the continued discrimination that people with disabilities who are admitted under the Mental Health Act experience. As I said, we've completed our first round of the review, and we're just coming up to our second round of review with the CRPD. And so behind the scenes, there's been a lot of ongoing work in preparing for that. Because of COVID, it's been delayed a little bit. But we're interested to see what Canada says that it's done in moving forward. And we're also, as a disability community, looking forward to challenging some of the notions that Canada is far advanced on conversations about disability. And I mean, and good things. So you may have heard that in 2018, Canada passed federal legislation with the Accessible Canada Act, which, the disability community was engaged the entire consultation process. And we worked really hard to address some of the points that were of note to our community. If you are not aware, in Canada, we are a federation. So the federal government oversees any federal bodies, but we also have provinces and territories which write their own legislation. So there were gains with the federal legislation, but there are also continued difficulties in ensuring that people across the country benefit from equal rights. Some of the gains with that particular legislation were communication disabilities were recognized. We worked really hard to ensure that that language was included. As well, we worked to include signed languages, and in Canada, that's ASL, American Sign Language. LSQ, which I cannot pronounce because my French is terrible, and also Indigenous signed languages, which we have many Indigenous signed languages. So this allows people who are deaf and who rely on these languages as their primary communication to advocate to have access. And we saw this immediately with COVID-19, that we saw sign language being offered in any of the health announcements that were happening across the country, which was really amazing for the deaf community to have access to information in their own language. So provincially, we've had a number of accessibility legislations come into force over the last decade or so, Ontario being our first. British Columbia, where I am, has just tabled what is Bill 6 has been tabled, which is the proposed legislation for British Columbia. There are a lot of concerns from our community that it falls far short of even the Accessible Canada Act, including there is no recognition of the diversity of communication disabilities. There's no reference to human rights within the legislation, and there's really no teeth in it. And that's where the federal government repeatedly told us that they were limited on how they can enforce it across the country and only in federal jurisdictions. So they, repeatedly we've been told to look to a provincial legislation to have that real access to address discrimination. And unfortunately, right now in BC, the current bill is not addressing that. So we are trying to advocate behind the scenes on improving that bill before it becomes legislation. Other areas that we have been working really hard on accessibility and disability rights, our council in particular, are around immigration and access. We continue to see really discriminatory practices around immigration and people with disabilities, including statements by judges that, somebody who wants to marry a person with a disability in Canada surely can't love them. How can you love somebody with a disability is insinuated, although not stated. It's always framed as they must just want access to our country and our resources, which is disappointing. We also, as Charlotte mentioned, we have continued difficulties with employment. There's been some gains with accessibility, and we do see the federal government and some of the provinces and territories taking the lead on accessibility and employment. We have some challenges around housing and accessibility. Often funded housing strategies will say, 5% accessible. And I honestly believe it should be 100% universal design from the start. Why are we investing in inaccessible homes? And recently, CCD has taken on looking at climate action and climate change and how it impacts people with disabilities in Canada. And we're investigating what actions we can take to improve current legislation and plans to be inclusive of people with disabilities. And just briefly, I'm going to talk a little bit about COVID-19 and the impact in Canada. So we saw very much some of the similar things like personal support workers who were not allowed to go to individuals' homes. And so what we really recognized was this disconnection between assumptions that people with disabilities who require supports must be living in long-term care or in institutions, not a recognition that often one personal support worker might be supporting 3 or 4 households with accessibility issues. And it was really problematic at the beginning of COVID, especially in having access to those. We've seen the triage protocols when hospital numbers go up that discriminate against people with disabilities, and assumptions about what our lives are like and whether we should have access to emergency care. And we've also seen, very limited resources offered to people with disabilities. For about 40% of Canadians who get the disability tax credit and are recognized under that, there was a $600 bonus that was sent to those individuals only to help with the extra costs of COVID. So many of us did not benefit from that and have had increased costs during this time. And that brings me to just really one of the biggest disparities I see among legislation, policies, and services is how disability is defined and who benefits from different programs and policies and legislation. And that disconnection, I think, is one of the greatest barriers to full inclusion. As Charlotte had mentioned, if we include all people with disabilities, we're looking at about 20% of the population who have needs that need to be met and yet are often not counted or included in opportunities. And so one of the things that the council has been doing is really advocating for a standard CRPD aligned definition of disability across the country for these services and resources, and then training so that people who provide those services and such are aware of that definition and of inclusion. And finally, I'm just going to briefly mention, so my PhD work, which I'm going to be defending in the fall, I focused on disabled mothers, which is Article 23, looks at family and inclusion and human rights. And, you know, from my study and many other studies in this area, we continue to see that government doesn't recognize that disabled people become parents, that we want to be parents. We may want to adopt or foster, and there are huge barriers to that, or also accessing in vitro or other reproductive technologies that are available to all Canadians on paper, but often are not available to disabled individuals who want to become pregnant in that way. So I'm excited for that, you know, information to come out, and I'm looking for anybody out there who's also doing research on disabled parents. I'm interested in what countries are looking at with regard to that conversation. So I'm just going to go off for now and hand it over to Michael. Thank you.
Thank you ever so much, Jewel. And so I've been asked to speak about the United States and Americans with Disabilities Act, and trying to bridge with what Charlotte presented earlier. It's true that the ADA in many ways set some good examples for the CRPD content and for the negotiations. And that was a great source of pride. Including the use of some of my work on reasonable accommodations and others. But on the other hand, you know, this was during Bush II's administration, and that administration took the position that, and it was the only government in the world that did, that disability rights were a matter of domestic pursuits. Every country should attend to their own, and it wasn't a matter appropriate for international law. And while they did not actively block or restrict the treaty from developing, they also officially, from the floor of the United Nations, did very little, if anything, to move forward the treaty during at least the first 6 ad hoc sessions. There were 8 in total, plus 1 rubber stamp. During those first 6 ad hoc sessions, the US, in fact, did not speak from the floor of the United Nations, and did not permit those delegates who represented the United States to speak from the floor of the UN. This was personally painful to me because there were some very wonderful people who were there. Most notably, John Wodach, who headed up the ADA section in the Department of Justice since its inception. And at that point, it had been for some 12 years. But John and others were enormously helpful. Across the board politics, by the way, Pat Morrissey, who had been a Reagan administration individual and worked on rehabilitation, were enormously helpful to those present during the negotiations, helping us all to understand reasonable accommodations, good and bad practices, good and bad lessons learned. As Charlotte mentioned, the US is one of only 11 countries in the world that has not ratified the CRPD. One can ask in Q&A if you like about that, but it can be looked at many different ways. It could be looked at as a victory that the Senate voted 61 out of 67 necessary votes for treaty ratification, or it could be looked at as being part of the US viewing itself as being exceptional, not joining in a formal sense through the Senate in international human rights treaties. In that sense, the US is the one and only country in the world not to have ratified the Convention on the Rights of the Child, and is the only country, in addition to Iran, one of the few ways that our countries seem to get on nowadays, in not having ratified the CEDAW, the Convention in favor of the elimination of discrimination against women. The current administration under President Biden has expressed great support for the disability rights community and for re-engaging with the CRPD, but one would imagine, given the mess that we are in politically, economically, health-wise, and otherwise in the US, that it would not be one of the great priorities at this time. Shifting back to the US, we've just passed the past 30 years of the Americans with Disabilities Act. July 26th will be the 31st anniversary. In many ways, it's been a wonderful, wonderful statute. I'm in my 50s, and I know what it's like to have lived as a person with a disability, basically without civil rights and with civil rights, and what the worlds look like before and after. And I could say affirmatively that the world is much better. It's imperfect. Many people struggle, many people, because we're a civil rights-based country, it is incumbent upon individuals to claim their civil rights. Very infrequently will the government make the effort to go and enforce them on our behalves. So, it's a work in progress. We have been a complete disaster as far as employment, and that cannot be laid at the feet of the Americans with Disabilities Act. It pre-exists the ADA. Our employment rates have not raised, not gone up, not a tick in the 31 years of the ADA, nor have they gone up in the 30-something years prior to the ADA. And it seems as if it has not been a national priority that people with disabilities can and should go out and work and have that social connection, money-making opportunity, and agency as other individuals. For many years, it was explained that the reason we have such poor employment rates was that we didn't have national health insurance, still remaining the one and only developed country not to have it. Through the Affordable Care Act, otherwise known as the Obamacare, we saw some inroads in that respect. But until then, there was a chokehold on people with disabilities. Either they could go to work and lose their federal government supported health care, which meant that your ventilator wouldn't be paid for, your medication wouldn't arrive, your personal care assistance wouldn't be provided to you. Or you can make the great leap forward and try to do it through employment, and many of us have, but we're in the minority. And so it was explained to us, looping back to the CRPD, that one of the reasons the Obama administration did not actively support CRPD ratification was that they had put all their political eggs into the basket of trying to pass Obamacare, and that was the best thing they could do for Americans with disabilities as far as our lives. They were probably right, but it was still a painful moment. The reservations, understandings, and declarations, meaning we'll take the treaty, but list of things that went with the CRPD basically said the US was not committing to anything other than what it had to do otherwise under federal law. And I am one of two people who did the National Council on Disabilities study of what that would have meant. So I can tell you that that's accurate. On the other hand, as far as getting around in the world, or in Jacobus Tenbrook's terms, the right to live in the world, the ADA has made a huge difference. The idea that one can go into a library or get on a public bus or visit a restaurant or go to a movie theater and do all the sort of normal things that those without disabilities take for granted has been pushed forward at a magnificent pace by the ADA, and our lives are much better for it. There are still areas we need to look at, and I note in the Q&A, we have a question we'll come back to in a moment about the digital divide and accessibility on websites. And Jewel, you and I can talk about that in just a moment. But the ADA has been wonderful in these public accommodation sorts of areas. What has COVID done? Well, it's said that COVID is the great equalizer, and that, of course, is a load of rubbish. What COVID is a great magnifying glass on the inequalities, disability and otherwise, that exist in our society. And what we saw with COVID was the idea that people with disabilities, much to mirror Jewel's intervention, is that people with disabilities were left behind, both in the formal sense, in what are known as crisis standards of care, the policies put forward by every state government on who to triage and who to treat first. Many of these existed before COVID. Many were adapted and amended during COVID. Some had formal policies of exclusion. So the state of Alabama said upfront, people with severe intellectual and other disabilities ought not to receive ventilator and other emergency services. That policy was amended through advocacy, legal advocacy, by those of us in the disability rights community who went to the Office of Civil Rights and the OCR under the Trump administration, forced the state of Alabama and many other states to revise their CSCs, crisis standards of care. But there are more implicit ones that went to quality of life and other things that had a disparate impact upon people with disabilities. For example, the use of long-term survival prospects. That has nothing to do with whether a clinician treats you for COVID. The clinician's job is to save your life and to get you out of the hospital. Whether you're going to live for 2 years or 20 years or 200 years, and that's playing God, of course, based on empirical evidence, is not relevant to whether you should receive treatment. And yet long-term prospects were included in many of these crisis standards of care. So too were short-term prospects. And the impact upon people, for example, with cystic fibrosis or Down syndrome. And by the way, those of us who are of color and who have other comorbidities related to being people of color and their social determinants of health were dramatic. And so we saw it in that. We are seeing it continually now through the vaccination priorities and lack of priorities. Through very good advocacy, people with Down syndrome and their advocates managed to get the CDC, the Center for Disease Control, to include Down syndrome as one of their protected categories who ought to receive priorities. And that's great. But what about other individuals with intellectual or other disabilities who are equally or even at greater risk of health due to COVID and lack of vaccination? That was just a mess going state by state. And reflected how much advocacy there was or there was not in every state as to who would receive priorities. So that's an issue that's going on now. Looking ahead, we wonder what COVID and other things will affect regarding employment and healthcare. In the employment sector, for many years, employers said that telecommuting was not a valid accommodation, that people had to physically be present at work. You needed to have quote unquote face time. Otherwise, you could not perform your essential job functions under the ADA or otherwise. Well, COVID made everyone rethink that, either with a disability or without. Everyone was telecommuting unless they were a frontline worker. And so the question is, what happens now as we return to quote unquote normal? Will people with disabilities and others, people with family commitments, other reasons why they might not wish to commute, will they be allowed to telecommute to work? Well, you don't know yet. And also, what will happen with healthcare after COVID? Now that we've seen the discrepancies, now that we've seen the cracks and the social inequalities, will we have a commitment to greater social equality or not? The Biden administration is promising that we will try to move forward. They've included people with disabilities in various of these subsidies and other programs. I had the honor of speaking at the White House a few weeks ago, maybe it was months ago, about why we ought to do things related to employment and healthcare. But the question is, we don't know exactly what will happen with that otherwise. And of course, the big elephant in the room that no one talks about is AI, artificial intelligence. In 20 years, it's forecasted that we will lose 800 million jobs around the world. Where will people with disabilities fit within that number? Will the world wake up and understand the prospects and the advantages of employing people with disabilities, including by telecommuting and otherwise? Will they be included in the AI and the continuing digital revolution, or will people with disabilities be left behind? It's a good question. Jewel, I wonder if I can throw over a question to you. We've had a couple of interesting questions in the Q&A, and I encourage participants to continue to send them in. But perhaps let's segue right immediately into the notion of digital divide. And that is, we have some very good awareness raising work on the digital divide and on lack of accessibility. Within the US, we often puzzle at why it took so long for the Justice Department to issue interpretive guidelines on why websites should be accessible as places of accommodation. We often wonder why businesses continue not to make their websites accessible. One would imagine they would want to have as many customers as possible. A recent case here in the US involved a pizza company, well known, that basically refused to make their website accessible and refused to deliver to blind people. Because after all, you never know what would happen with that exchange of money, and they may be cheated. So better not to give them services than to deliver to them. What do we need to know? what should we be thinking about as far as moving forward, making data accessible, making websites accessible? How is this, should this be part of the larger inclusion and diversity movement?
Sure. That's hilarious, Rita. I didn't know that happened with the pizza place that you just mentioned. Um, I mean, in Canada, first of all, one of the things with the Accessible Canada Act is we have 3 different sets of regulations, and one of them is around websites and communication particularly. And so a big area of conversation is how can we ensure all of our communications in Canada are brought up to W3C standards or exceed those standards of accessibility. And then how will we, when there are barriers, what can be done about it? And that speaks to the conversation about a lot of the legislation doesn't appear to have teeth. Canada takes a long time to actually get to something. There's a lot of time spent on consulting and then consulting the consulting, and so it's an ongoing barrier. However, one of the things with COVID-19 that I have seen is an improvement on a lot of these conversations in ways that I didn't see before, and a pickup from activists who are outside of the disability community. Maybe it's because we were all stuck at home for so many months. I'm in 15 months of being at home, but there were conversations about accessibility and better ways to be fully accessible. And I think the Black Lives Matter movement really helped shine a light. And then I just saw activists become engaged across conversations. And so I'm always hopeful. That's my attitude. I'll call out where the disparities are, but then I'm also like, this is exciting. And also to what you mentioned, Michael, about the refusal to accommodate those of us to work from home, where it might have been a much better situation for us to do that. I had experienced living in the interior of British Columbia in a remote community that the highway closed all the time in the winter, but I was going to school a 2.5-hour drive away. And at first the university refused to accommodate me to maybe Skype into my classes back before COVID. And I had a car accident, a really scary car accident. And suddenly they had a conversation, but they made a big deal about it every time I requested to Skype in because, the roads were bad. And now we see everybody is Zooming in or Teams or whatever format is being used. So I hope moving forward, there won't be a divide between that accessibility, but I also think there needs to be conversations about ensuring the platforms we all use are accessible, ensuring that we have access to appropriate internet to do those, and that the costs in Canada, the costs are really high. We don't have the competitions you all have with your providers. So here, your cell phone is over $100, your internet is over $100. And these things really add up for us. So I think there are so many conversations about access.
Right, and it often drives me a little to distraction about why webs, when they're designed, don't begin with universal design. I mean, the WAG guidelines are very clear. You can, they're just down the street from me too, but it's very easy to look that up, very easy to implement it. It costs very, very little. Under 1% to design a website initially that's going to be accessible and include people. And yet companies continue to resist it. The Papa John's was one we mentioned. Target for a long time was another. Much of the advocacy by the Brown Goldstein firm on behalf of the National Federation of the Blind has focused on these large providers, large websites that should in theory want to get business, but instead put up the walls. And as a law professor who teaches future lawyers, all I could point to are ill-informed, greedy, rubbish lawyers who say you don't need to do it. But why would you not want to have business? It doesn't seem to make sense to me. Let me throw out rephrase another one of the really good questions that we got, and that is, the CRPD is a national thing, right? I mean, it's an international treaty. Governments, whether it's Canada or hopefully one day the United States, ratify it. But in most countries around the world, to be a law professor for a moment, you need to have enacting legislation, right? Either you're in a country where, like Ecuador, the minute you adopt a human rights treaty, it becomes part of the Constitution and anyone could go into court and cite it. But for many, many other countries, including Canada, the US, United Kingdom, you need to have enacting legislation. So there has been as well this sort of movement as far as federalism. Either states, or in your case, provinces or cities or localities, have tried to support the CRPD and tried to include it in their policies and the ways that they view and enact and treat people with disabilities. Can you talk a little bit about maybe what you're seeing in Canada and what some of the prospects are for enforcing, implementing, raising good practices for the CRPD through more local initiatives?
Yeah, so as I had mentioned, the province I live in is currently in our House. It's the conversation Bill 6 is going through. And that's really for us where many of court cases could potentially happen through that piece of legislation. We do have our Charter of Rights and other legislation already in existence. Unfortunately, it just often feels like what is truly important is missed in these legislations. And then the other aspect is that often the judges and the lawyers and experts that are called maybe are not truly informed on inclusion, accessibility, and ableism, and the impact of their biases when they're making decisions. And as I mentioned briefly, for my personal research, it's on parents who, the judgments are often against people with disabilities or access to certain things because judges are biased and make assumptions about disabled lives. And there isn't that missing piece of education. I think there's an opportunity lost. And I see that in so many other aspects that often there's an idea that disability is a charity conversation, not a rights conversation. So you should feel lucky you have access to, the Handy Dart, which is a special, bus that you can plan. You have to plan 48 hours ahead to book it and access it. But you can't, if you're a parent, you can't bring your infant on with you. And, but you're lucky you have that transportation. And why would you argue? Look at you, you can go to the community. And in so many places, I see that failure in our actual legislation to have, both the teeth in the legislation and then the education on the people administering the legislation to understand what full inclusion and citizenship looks like.
And here in the US, we're seeing in our notion of federalism, the idea that local communities, municipalities, and even states can do things differently from the federal government. So in the 90s, we saw that with stem cell research, where the government, of California decided that was something that they wanted, whereas the federal government under the second Bush administration was not in favor of it. And we've seen it in areas of LGBTQI rights. We've seen it in other areas. With the CRPD, we're starting to see municipalities, states, and others who say, although our federal government has not ratified it, this is something that we want to accede to. This is something we want to live up to. I had a meeting with Cambridge, my local city of Cambridge, commission just a couple of weeks ago, and we're moving the mayor to try to join it. So there are initiatives as well that we can do these things with locally to try to make the world more CRPD-ish. Since we're here with the ABA, we ought to note that although the CRPD is not part of our national law or even domestic laws, we have seen a small trickle of cases specifically on the area of legal capacity and supported decision-making arise in the jurisprudence. We've seen both the influence of the CRPD on state level laws. Texas, of all places, was one of the first states to enact supported decision making. It falls within their idea of everyone being independent and autonomous, which of course we're not. We're all dependent upon each other. We're seeing some of our local advocates that we work with at HPOD, Massachusetts Advocates Standing Strong, and SANI's, the self-advocates of New York State, having pushed their states for amendments to their guardianship laws and for recognition of supported decision-making agreements. And we're starting to see a small trickle of cases at the state level, mostly New York State, acknowledging the CRPD, acknowledging it as the standard and trying to move us in that direction. So hopefully we'll see more on the local level as well, even as we struggle in different ways, you and I, with our national governments on where we are. But let's pivot to another question, Jewel, and let's talk a little bit about the role of social media. So we've mentioned ableism, but only briefly in our discussions, and the pervasive stigma that still exists. Ableism, for those of you who are watching, of course, is not only prejudice against those with disabilities, it's also a general prejudice based upon what the accepted, normal, idealized body notion is. So the same kind of ableist ideas that would exclude Jewel and myself on various issues of disability also would exclude those who are not able-bodied, white, Christian, heterosexual males. And so the idea of what is the proper body type, which doesn't map out well if you're female, or you're LGBTQI, or you're an indigenous individual, or you have other forms of identity. Nowadays, our world is digital, and we're interacting with each other through the web more and more, although many of us still don't have access to it. How can we use social media to educate our societies about people with disabilities? What are some of the good things you're seeing in Canada?
So we did a really interesting thing, CCD, with the medical assistance in dying change that just recently happened, Bill C7, which added disability as a reason to access euthanasia in Canada. And in less than 18 months, the plan is to also add mental illness as a reason to access euthanasia. The disability community fought really hard against this bill. It was pushed through our levels of federal government. And one of the amazing social media campaigns that came about started with our Ending of Life committee with CCD, had a meeting, what can we do? Normally, in normal times, we would have flown into Ottawa or traveled to Ottawa and protested, and yet we couldn't because of COVID-19. So we created an online filibuster that went 24 hours a day for a number of days, and engaged several speakers for each segment of disability, people with different disabilities from all aspects. So communication disabilities, physical disabilities, wheelchair users, people on the autism spectrum, developmental disabilities, everything from, brand new young activists who have just found their voice to long-term, advocates like Catherine Frazee was one of our leaders in that filibuster. And it was incredibly excited to see the people that turned in and had conversations they'd never thought about, the barriers that communication disability puts upon you if you're trying to access medical care during a pandemic, for example, or what it's like to live with autism and be told that maybe your life is not worth living and medical assistance in dying might be your option. And people talked about, going into the hospital and how they were treated, and assumptions and conversations that would happen around them as if they didn't have their own voices in those contexts. And so for me, that was one of the most powerful moments of this pandemic was, how do we pivot and protest and use social media and use what's, at hand in order to talk about a really critical issue in our community. So that was just one example of what happened up here in Canada.
And then we're seeing, I'm a very old-fashioned, maybe old, disability rights advocate, and not one who's very adroit on social media, but I do believe that it is the way forward, and we're seeing some interesting work on it. So our friends at the Ruderman Foundation have done an almost complete pivot towards raising awareness on mental health and also on how disability is portrayed through Hollywood and through other media. The idea being that if we see people with disabilities, if we see them performing ordinary, quote unquote, normal roles, some of us are better than others, some of us are nicer than others, some of us still have ways to go in our development, that it becomes normalized, less othered, and that we can be included in society. What we have seen, though, with that is not enough light being shed on the intersection of disability with other categories. So here in the US, we have continuing issues, sadly, tragically, with people of color and interactions with the criminal justice system. And what is a smaller side issue to that is that very often these are people themselves with disabilities. And yet when these issues are covered, the idea that the individual was having a mental health issue or was deaf or hard of hearing is often subsumed under the issue of race, which is very, very important. But the idea that people with disabilities are having this access to justice issue hasn't been raised as much. So we're hoping to see more in the social media and more attention brought to it. We're coming to the end of our hour, but I wonder if you could give us some good advice, especially since your connection with the Canadian Council, on the role of advocacy and the role of self-advocates in changing the world. The idea that we have laws that are up here and our lives are, somewhat further down here, and that to bridge the gap between them, we need to have advocates involved, people who claim their rights. Lawyers are great, I'm even one sometimes. But really, it's individuals claiming their rights, claiming their own voices. Talk to me about the Canadian Council and about some good things that are going on in Canada.
Sure. So one of the things the council has, we are actively engaged in education. So what does it look like to translate the CRPD into lived experience and rights? And so we've done, webinars, and before the pandemic, we had in-person meetings and conversations. I almost feel like the webinars open up to a lot more people than would normally come to an in-person webinar. But these opportunities to learn about rights, and then how do you engage your government if they're putting through accessibility legislation that is problematic? And so, one of the things we've done is worked with Include Me, which is a cross-disability organization that helps, write letters to the senators during that process, or letters to the MPs or MLAs during processes. We've also really been working at amplifying voices in our, media, so radio, television, and print, and how can we amplify the voices? So I've been putting together with my new role with the council, that a list of individuals who are ready to speak to issues, and then also individuals who are interested in learning how do you go to the media to have a conversation. And I do think what you just said, the bridging, I always call myself a bridger because I am very much embedded in community activism, but I'm also been trained in how to interact with the government and then with the international treaties on addressing rights. So I'm always open to conversations with community, and the council works really hard to create spaces of convening to talk, and to then, amplify those stories at the government level. And I guess finally, as a social scientist and a qualitative researcher, gathering those stories for me is one of the most critical aspects. I can talk, if I have to, numbers and quantitative research when I meet with government, but nothing is more important than when you talk about, one person, their actual story and what it looks like to navigate access to housing or transportation or employment. And then if you amplify that to 20% of our population is somehow, having these struggles, what is the government going to do?
And so I agree with you, and both here in the US and the rest of the world, and I've worked in 44 countries on the ground. Nothing about us without us is still the theme. People with disabilities know their rights better than anyone else, much like everyone else knows their world and their rights and their needs and priorities more than anyone else. And it's been humbling and wonderful, at least in my work, to see people who have been told for their entire lives that they were subhuman, didn't count, and now are able to point to this UN convention and or a national law or statute, and use it in the way that human rights and political theorists, Catherine Sicking would say, is a signal or a watermark to say that that's what we aspire to, that's what we need to get forward. And we saw the role of people with disabilities in many different ways in the US, whether it was the independent living movement or support of the Americans with Disabilities Act, the Americans with Disabilities Act Amendment Act, after the Supreme Court gutted most of the ADA during its first 12 years, 14 years. And so the role of civil society, the role of people speaking for themselves and seeking their voice and seeking their rights has always been really the clarion call of all civil rights, and it goes across all identity issues. So we are going to wrap up now. I'd like to thank everyone for joining us for this webinar. We'd like to express our gratitude to this esteemed group of panelists, including Ms. McClain-Nhlapo, who had to leave early. Both of you, Jewel and Charlotte, you're doing such critical work, and I thank you for taking the time out of your schedule to share your experiences. The section of Civil Rights and Social Justice provides free webinars and resources for legal professionals and advocates nationwide. We hope that this helps you in your work. Again, if you can, please consider joining and becoming active in the ABA. You can do so by visiting ambar.org/CRSJ. It's in your web chat. I also encourage you personally to come to the Harvard Law School Project on Disability website and join us for all our events, www.hpod.org. Good luck to everyone in your work. Thank you